Globally, 1 in 5 babies in the 1950s did not survive past 1 year old. And here in the UK, 3% of all babies did not survive past 1 year old in the 1950s. Look around you at all of your family and friends and think how many child deaths you would have seen before 1 year old in the 1950s. Science, advancements in medical care, vaccinations, things like vitamin K have meant that children survive past a year old. More children survive past 5 years old, and they go on to live long and healthy and happy lives as adults. And in the 1800s, before advancements in medical care, before vaccinations, 1 in 3 children died before 5 years old. And here in the UK in the 1950s, we started seeing universal healthcare for all people in the NHS. At this time, before 1 year of age, 31 per every 1,000 babies who were born died before a year old. These are babies who were born alive. We now sit in 2020 at 4 per every 1,000 births of babies who do not survive past a year, and that includes extremely premature babies at 22 weeks. And you can see from the history of vaccinations and the vaccination programme that has come in here in the UK, you can see that child mortality has dropped with the increasing amount of vaccinations that have been developed against completely preventable illnesses and infections that we now have the ability to vaccinate against. And the biggest cause of mortality under a year old for these babies in the 1940s, 50s, things like whooping cough, things like tuberculosis, pneumonia, things like diarrhea and vomiting. Again, all preventable thanks to the introduction of science and vaccinations. It's amazing that we live in a time where we have access to these. Isn't it incredible that we no longer see huge outbreaks of things like rubella and mumps, for example, where tuberculosis rates have dropped, where women have access to anti-D and so they don't have that rhesus incompatibility where their baby either dies, sadly, or doesn't need a complete blood transfusion after birth to basically filter their blood. And some of those effects are so profound. My mentor, when I trained in 2009, who was almost retired, trained in the late 1970s. And they were educated at that time about rubella in pregnancy, about stillbirth, blindness, birth defects. And in the 1960s, it impacted about 200 to 300 babies per year with birth defects of mums who caught rubella during their pregnancy. That's 200 to 300 babies a year here in England and Wales alone. We're so lucky that we live in a time where we don't really see that anymore. It is part of the touch screen if a woman develops polyhydramnios during her pregnancy or if there are fetal abnormalities detected. And whilst interventions right now are probably overused in maternity services, the introduction of things like inductions of labour, caesarean births, anti-D. My gran, who had a negative blood group, my uncle had to have a complete blood transfusion straight after birth because there was no anti-D there. My mum was severely anemic and needed a lot of injections in that postnatal period because of the rhesus incompatibility that they had. Again, the introduction of anti-D made things so much better when that came in. Now, I'm not for 1 minute saying that advancements in medical care, vaccinations, the interventions that we have that are available are perfect. They all come with side effects. They all come with risks and benefits. But isn't it amazing that science has developed something that helps to prevent it, stop it, and stop the long-term harm and effects of whatever that is? And isn't it incredible that globally across the world, more women survive childbirth, their babies survive childbirth. We have the best advancements in preterm birth and care where 22-week babies now survive. And lots of them survive without that brain impact because of advancements of things like magnesium sulfate and steroids for fetal lung maturation. Isn't it incredible that we have access to caesarean births and we have access to medications to stop postpartum hemorrhages? We have medications to try and help a woman stop fitting or prevent it in the first place for preeclampsia. We have come so far with science that it really improves outcomes for both mums and babies and children lifelong. Science is wonderful and we are so lucky to live in a time where we have access to healthcare, where we have access to scientific advancements, where our babies and our children have access to this healthcare system. It's not perfect, there's still a long way to go. Women's healthcare is still massively under-researched and underfunded, but we are getting there bit by bit.